Hi, welcome to video 5 of the Student Nurse Bootcamp, and today I'm going to talk about the history of nursing. It's very important, and if you have never heard or don't know much about Florence Nightingale, you're going to learn it right now. Her, as well as many other amazing women, elevated the nursing profession. Before it was not a noble profession. Prisoners would do like the work that a nurse would do because they thought that that was fitting for them. So let me tell you a little bit about Florence, and then I'm going to read to you a few others. There's so many important people in nursing, but she is the main icon. You know, during our nursing pinning with the lamp and the candle, that's what she used to get around in the dark during the war. So she's very symbolic, and she's extremely important in our nursing profession nowadays. And many things that she implemented and things she came up with, we still use nowadays. Tweaked and, modified and developed, but she was the one that made a lot of connections in the medical world. So first and foremost, many of you may know May 12th is Nurses Day. Why is this day important? It's her birthday. She was born in 1820 in England to a very wealthy family, and so May 12th, 1820, okay, like I said, in England to a very wealthy family. She was extremely educated, and her family traveled quite a bit. When she turned 31, that's when she wanted to start training as a nurse, and her family was not happy at all because, like I said, it was not a noble profession at that time. So when the Crimean War started breaking out, the British asked her to organize nursing care at I want to say a base, but that's not correct, in a military hospital in Turkey. And that's where she kind of developed and realized and made connections to a lot of things that we use today in nursing. And this is where she really started to elevate women, their roles in nursing, how important, well, and now men, but elevated it to a noble, decent, important profession that it is today. And so I'm going to read off a few bullet points from my text just so I don't forget anything. So her contributions include identifying personal needs of the patient and role of the nurse in meeting those needs, establishing standards for hospital management, establishing a respected occupation for women, establishing nursing education, okay, recognizing two components of nursing, health and illness, okay, believing that nursing is separate and distinct from medicine. Nursing, we have the caring component, not just here, take this twice a week for whatever. Recognizing that nutrition is important to health and healing. Instituting occupational and recreational therapy for sick people. Stressing the need for continuing education for nurses. Maintaining accurate records, documentation, and recognized as the beginnings of nursing research. She also, to add on a couple more things, she also made the connection to well-ventilated areas, to how sick someone was and how they were getting better. How clean an environment was had a lot to do with infection and health and them getting better. So as time went on, patients, they didn't lose as many during the war because she was making these connections and documenting things and educating others, and it just kind of developed. And then she came back and she started her own training program in England. So she's a very institutional part of nursing. You will hear about her, you will learn about her. So I just kind of give you a few quick reference points to that. Oh, and nursing. Latin word is nutrix, and it means to nourish. There you go. Here's a few more important women in nursing. By all means, I know I'm going to skip over some important ones, and if your instructors had you learn ones that maybe I'm not covering, I'm just going to read quick little snippets of each woman. please feel free to add them down below as someone else may benefit from that. Clara Barton volunteered to care for wounds and feed Union soldiers during the Civil War. She served as a supervisor of nurses for the Army of the James, organizing hospitals and nurses, and she established the Red Cross in the United States in 1882. Dorothea Dix served as superintendent of the female nurses of the Army during the Civil War. She was given the authority and responsibility for recruiting and equipping a corps of Army nurses, and was a pioneering crusader, for the reform of the treatment of the mentally ill, mental health nursing. Dorothea Dix. Linda Richards graduated in 1873 from New England Hospital for Women and Children in Boston, Massachusetts, as first trained nurse in the United States. She became the night superintendent of Bellevue Hospital in 1874 and began the practice of keeping records and writing orders. Lillian Wald established a neighborhood nursing service for the sick poor of the Lower East Side of New York City and the founder of public health nursing. Mary Elizabeth Mahoney graduated from the New England Hospital for Women and Children in 1879 as America's first African-American nurse. Harriet Tubman, you might remember her from obviously history, the Underground Railroad, a nurse and an abolitionist, tongue-tied, active in the Underground Railroad movement before joining the Union Army during the Civil War. Mary Agnes Snively, director of the nursing school at Toronto General Hospital and one of the founders of the Canadian Nurses Association. Isabel Hampton Robb, a leader in nursing education, organized the nursing school at Johns Hopkins Hospital, indicated policies that included limiting the number of hours in a day's work, and wrote a textbook to help students learning, the first president of the Nurses Association Alumni of the United States and Canada, which later became the American Nurses Association. So I'm going to end you with that. Very important women in nursing. There's many, many more. These are just 19th century nurses. So please know the history of, it's what you want to do. You should be interested in it. And, we didn't cover this over days. It was a day's lecture, but it was very interesting, and it's important to our career field. So look them up, do a little more research, or just listen to this video a few times, and you will know the importance of Florence Nightingale. Very fabulous woman, and definitely made our profession a wonderful one. So have a good day, and I'll talk to you later. Bye.